We've expanded rapidly over the last couple of years, and what I see coming is we're kind of building our foundation a little bit bigger. We're adding more capacity, is what we know most health systems in this country are at or near capacity. Same here. So they're adding significantly to different campuses and kind of meet the needs of what the growing population is. From my perspective as the chairman of this department, we've seen that quality improve our outcomes of our patients. Not only ED spaces, in the inpatient spaces, and the outpatient spaces, you detect more things than we do by far in the past. So the Apex platform has really improved patient care at our institution. One, the detail you're getting out of the images is significantly better. The pathology we're picking up is significantly better. And the subtleties that we had issues with in the past, trying to determine whether it's calcium versus blood, have gone away. You just want the best you can be from a system. And this offers an incredible level of quality I have not seen in any other system out there to date. So getting rid of the older system, you think you were good 10 years ago, you think you're good 5 years ago, you upgrade to this particular platform and this particular Apex system, you will notice a huge leap forward in the quality of what you're seeing and what you're doing for your patients. You don't know what you don't know until you install it. So whether you do it on one system or you do it on 22 systems or 30 systems, whatever it may be, it blew my mind because I thought we were doing a great job. Oh yeah, we're now doing an extremely good job. And what I liked about our purchase of this particular platform, we have a consistent upgrade pathway. I don't want one system lagging versus another. We will have a very consistent upgradable fleet for the next 7 years. From both administrative and a radiologist hat, and you're going to wear them both. Getting the highest quality out there from a radiologist perspective, you don't know what you don't know until you see this equipment and you see it installed and you see what it can produce and you see what it can do for your patients.